follow me and sit down. Maintain privacy, perform hand hygiene. My name's Hailey. I'm going to be your nurse today. I'll be doing your physical assessment. Can I see your name, band? What's your name and date of birth?
Brendan Rowe, September 3rd, 1999.
Okay. Mr. Rowe, do you know where you are today?
I'm in my house
Do you know why you're here?
for a physical assessment.
Correct. And do you know what today's date is?
It's February 13th, Monday.
Alright, so your alert and oriented times 4, person, place, time, and situation. I noticed that when you walked in, your gait was steady, your posture was erect, your speech is clear, and your affect is calm and cooperative. So what I'm going to do today is I'm going to assess your head, starting with your head. I'm going to look at your skin, and it's symmetrical with the rest of your body, and your face is symmetrical also. I don't see, is it okay if I can touch you?
Yes.
Okay, thank you. Are you in any pain today?
No.
Okay. I don't notice any lesions, edema, no scars, no texture. Look at your scalp. I don't feel any bumps. I don't see any lesions or edema or lice. Anything like that. Good. I'll be checking your eyes next. Can you pull down your eye like this? Look at your conjunctiva. Right, that's good. It's pink and moist. Are you alright?
Yep.
Okay. And your sclera is white and your cornea is clear. So what I'm gonna have to do is I'm gonna turn off this light just to look at your eyes. I'll be shining a light in your eyes, okay?
Okay.
Just checking for pearl. Are you ready? Good. Can you look at that piano for me? Okay, good. Turn this light back on. Your pupils are equal and round and reactive to light. Now I'm going to check your nares, which is your nose. So what you're going to do is hold one nostril, breathe in and out. Good. Other side. Okay, good. I'm going to check the inside of your nose with my light. Just for any redness, no deviations, and it's patent. I'm going to check your ears now. Are you having any tenderness in your ears?
No.
No redness and no drainage in that ear.
No.
About this ear, any tenderness?
No.
And there's no redness and no drainage. So I'll be doing your oral mucosa next, which is your mouth. Can you open your mouth and say ah? Okay. Your uvula is midline, and your mouth is moist and pink, and your teeth are intact. So now I'm gonna move on to your chest region. Is it okay if you take off your shirt?
Yes.
Okay, it'll be easier. And for your, I'm just gonna assess your skin again. So look at it. There's no lesions or edema or scars or bruising, and your texture, no texture, and it's consistent with the rest of your body and appropriate for your ethnicity. So I'm going to do, first I'm going to check your heart sounds, but before I do that I just need to make sure, go back and assess your range of motion in your head and your shoulders. So for your head, I'm going to have you hyperextend, right like that, and then go down as far as you can go, good, and then go to the left and the right. Okay, good. I'm going to put my hand next to your head and just push your head. Good. Do the other side. Push. Okay, good. I want to check your shoulders. Just raise your shoulders. Good. Right. Strong bilateral. So you have good range of motion. I'm going to check your elbows too before we move on. So can you place your hands out in front of you? Go like this. Flex. Good. Go down. Can you move your wrists like this? Around, good. And act like you're grabbing something really weirdly. Good. Okay. That's it. And now I'm going to move on to your heart. So I'm going to show the camera what I'm going to do for your heart. As on the right side is your aortic, which is your second intercostal space on your right side. Your pulmonic is your second intercostal space on the left side. Third intercostal space is your Erb's point. Fourth intercostal space, lower left of the sternal border is your tricuspid. And then your bottom right here is your mitral, which is your lower left intercostal space, the fifth intercostal space, and it's midline with your midclavicular line. So I'll be checking that on you. And the mitral valve, that one I'm going to listen to for a full minute and get your heart rate. So if you could just sit up a little bit so I can assess that. I'm going to check this. Okay. So aortic, pulmonic, your Erb's point, your mitral, and for this, or tricuspid, sorry, that's tricuspid, and this is your mitral. That's where I'll be assessing your apical pulse for a minute, okay? Great, for your apical pulse, I got 74 beats per minute. And your S1, S2 are regular. There were no abnormal heart sounds, no clicks, bruits, or murmurs. Now I'm done with your heart. I'm going to move on to your lungs. So I'll be checking 6 lung locations anteriorly and 10 posteriorly. So you just lay like that for me. That position is good. Just take a deep breath for me. Good, and if you could just turn over. Now listen at 10 on the back. Are you okay? Are you in any pain?
No, I'm not.
Okay. Breathe in and out. can turn around for me now. You have regular breath sounds, lung sounds, and no adventitious lung sounds. And they were regular bilateral, which is good. And you had no use of accessory muscles. So after your lungs, I'm going to move on. I'm going to do your carotid pulse. I'm just going to feel it, and then I'm going to listen for a bruit with the bell of my stethoscope. +2 equal bilateral. It's +2 equal bilateral. Just listen with the bell of my stethoscope. Thank you. You can just hold your breath. Good. You can release. So no carotid bruit bilaterally, which is great. So now that I'm done with that, I'll be assessing your abdomen. So if you could just lay down for me. And now looking at your abdomen, I don't see any distension, and it's symmetric. I'm gonna look at your skin. Let's see, there's no lesions, no scars, no edema, and it's equal to the rest of your body, and your skin color is appropriate to the rest of your body and your ethnicity. I'm gonna do for your abdomen, I'm just gonna listen to the 4 quadrants in your abdomen, which is right here, 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 here. And I'm gonna follow the poop, if you remember it like that. Start with your right side. Awesome. So while I was doing that, I could hear 5 to 30 gurgling noises in your abdomen. I checked in all 4 quadrants while I checked that. And also while you're like this, I'm going to check for a bruit with the bell of my stethoscope, any vascular sounds. Okay, no bruit noted. I'm going to palpate your abdomen. Just let me know if you have any tenderness or pain. Okay, Mr. Rowe?
Okay.
Okay.
Mm-hmm.
Now with your abdomen, now you can sit up again for me. We'll be assessing your extremities. Just looking at your arms for any pallor, cyanosis. I don't see any. Any edema, scars, or bruising? None. Good. Your skin is warm. And it is also on your arms. Equals the rest of your body. Don't see any there. And it's perfect for your ethnicity as well. Good. So I'm going to do your pulse sites, your radial pulse, which is going to be right here. I'll just feel that on you. +2 strong bilateral. Check your brachial pulse. +2 strong bilateral. And then I'm going to do your dorsalis pedis pulse. Okay, just lift up your foot for me. Do the other one as well. +2 strong bilateral. Get your here. Posterior tibial pulse. +2 strong bilateral. And then your femoral pulse, I'll show the camera. For privacy reasons, I will not be assessing this. It'll be right here. I should be. +2 strong bilateral. Now I'll be assessing your patellar reflex. Okay?
Okay.
For that, I'm just going to have you close your eyes. I'm going to use my hand actually. Just checking your reflex. Good. Other side. check your range of motion in your ankles and check for clonus. So you could just relax. Dorsiflex, plantar flex. Good. Good. No clonus noted. Check your range of motion over here. Dorsiflex, plantar flex. Good. You check your pulse, your capillary refill. So I'm going to do that with your finger. Good. Less than 3 seconds. And for your toe, less than 3 seconds. I think that's everything, Mr. Rowe, for you today. I checked your flexation in your ankles. Now I need to check for your hip, actually. I forgot to do that. And your knee flexation. So we need to make sure you can do that. For that, I'm just going to have you bring your knee to your chest. Good. Other side. Good. So your range of motion is strong. You have strength and it's bilateral as well, which is great. That's exactly what we need. So do you have any questions for me today?
No.
You can put your shirt back on. I'm going to leave your call light is right here, right next to you, okay?
Okay.
I'm going to leave your bed in the lowest position. I'm going to lock it. I made sure that hippo was maintained. And I'll be back in about 30 minutes. Do you have any questions?
No.
Okay, and I'm going to go document my findings.
Okay.
Thank you.